Hello, my name is Satish Lubeck and I'm working as a dermatologist and researcher at the Radboud University Medical Center in the Netherlands. As senior author, I would like to inform you on a recent study we did on the effect of a dermato-oncologic training program for general practitioners. The rising number of skin cancer patients puts a lot of pressure on our healthcare systems. General practitioners play an important part in skin cancer care, and optimal recognition and referral are considered of vital importance to optimize skin cancer efficacy. Previous research identified a rather poor clinical recognition of skin cancers by general practitioners, leading to a high rate of potentially unnecessary referrals to dermatologists. Therefore, the aim of this study was to evaluate if a dedicated dermato-oncologic training program for general practitioners improves their diagnostic skills and their quality of referrals. All general practitioners in our region received an invitation to follow a dedicated dermato-oncologic training program specially developed for general practitioners. This training program consisted of instruction on the project aims and guidelines, a mandatory online course, and 2 optional live courses on skin cancer and dermoscopy. Afterwards, referral letters to dermatologists were analyzed. Primary outcome was the agreement between the referral diagnosis made by the general practitioner and the final diagnosis made by the dermatologist. Secondary outcomes were the proportion of proper dermatologic descriptions used in the referral letters, the amount of diagnostic procedures performed by the GPs, the amount of additional pre-malignant and malignant lesions found by the dermatologist, and the proportion of potentially unnecessary referrals. Outcomes were compared between general practitioners who followed the training program and general practitioners who did not follow the training program. Furthermore, comparison with a historical cohort in the same population GPs was performed, called the untrained historical cohort. A total number over 1,600 referrals were analyzed. The referral diagnosis was more often correct in the trained cohort compared to the untrained cohort and the historical cohort. Furthermore, the trained cohort also had a better lesion description, more often mentioned the diagnosis in their referral letters, and more often performed diagnostics before referral. In addition, less potentially unnecessary referrals were identified in the trained cohort compared to the untrained cohort and the historical cohort. In conclusion, general practitioners who followed a dedicated training program had better diagnostic skills and quality of referrals than untrained GPs, leading to less potentially unnecessary referrals. This might enhance a more efficient use of the limited capacity in secondary dermatologic care and consequently leads to lower healthcare costs. In case of any questions, please feel free to contact me or my colleagues. Thank you for your attention.